Hi Donna, this is Kim. I'm going to be showing my catheterization video, inserting a cath. So I hope my props are set up okay. Okay? Okay. Good morning, Mrs. Smith. How are you this morning? Good, good. I'm going to be inserting a catheter into you because you're having some trouble voiding after surgery. Okay. So I have a table over here, Donna, with a trash can. Okay. And prior to doing this procedure, pericares would have been done on Mrs. Smith, and I would have washed my hands. Okay? Just a minute. Get down. Sorry about that. Harley thought he needed to be in the movie too. Alrighty. Okay, I'm going to be setting up opening up the catheter kit here. Okay, so always open away from you. Go on. Alrighty. Okay, got my sterile gloves over here. Okay, now I'm going to be taking out this blue sheet, which coming up here and laying down for my area that I'm going to be doing the catheter on, the sterile field. Oopsie. Didn't open. There we go. Okay. I'm going to be putting on my sterile gloves. I would also be putting this, I would have my sterile gloves on the table beside me, but I don't have an actual table beside me. So I'm going to be putting on my left glove to start with. Get out of here. Get. Touching sterile to sterile on the glove here. Always maintaining my sterile gloves above my waist. Alrighty, now at this time I can come in and fix this. I'm using a pop bottle, which is in the middle of the, well, you know where it is. Yeah, there. Not wanting to cross the sterile field. Alrighty. Okay, now I'm going to move my tray in closer. Take out the cup here, the urine cup, which we won't need. My betadine sticks, we'll take them out and get them ready. And yes, I do know these stain. I have helped, assisted a nurse before. Throw that on the floor. It landed on the plastic. This is for the cup. Okay, now I'm going to get my lube ready. Okay, so throwing that in the garbage. Okay, I am also going to now test my balloon. Are you doing okay, Mrs. Smith? Good. Okay, I'm going to test my balloon here. Okay, inserting 5 cc's of water. Okay, and some manufacturers do not want you doing this, so you have to always check your check the directions on the catheter. Okay, and the water is in there. Okay, balloon went up. Okay. Leave that there. Okay, now at this time, remove the end, the tubing from the plastic wrap, and keeping it in the box where it'll stay sterile. Okay, now at this time I'm going to take my left hand and I'm going to hold Mrs. Smith's labia back. So I'm going to pull it up and back with my left hand, keeping my right hand clean. I will take a betadine swab and go down one side of her meatrix, throwing that. I'm just going to lay it in the tray. I'm going to throw it there. I didn't get on my floor. Now I'm going to go across and do the other side. And then one more time, right down the middle. Okay, always maintaining my hands up here. Alrighty. Now I will grab the catheter tubing. I want to go down 3-4 inches here. And we'll just start inserting here. Mrs. Smith, I'm going to insert the catheter. Okay, 3-4 inches. Okay, now, there. Now I can drop my left hand and bring it down here and hold the tube, the catheter. And then at this point, I will insert the water. Are you doing okay, Mrs. Smith? We're almost done here. Okay. I'm going to pull on it a little bit to make sure it's inserted. Good. Okay. There. Alrighty. Okay. I'm going to drop this, which I can drop. And at this time now, I can start cleaning up my field. Just lift the corner here. Not touching the catheter bag. We'll take all this over and throw it in the garbage. And then I'm going to remove my gloves, put on a new pair of gloves. We're almost done here, Mrs. Smith. You've been very good. Are you having any pain? And when I was inserting water into the balloon, I would have been watching Mrs. Smith, watching for any facial grimacing and asking if she was having any pain. Okay, you're doing good, Mrs. Smith? That's great. Okay, now I'm going to unwrap the tubing. And then I am going to, you can either tape it the Y onto the patient's leg using either tape, or a lot of times there's like bands with the Velcro. Attach it there. And then I would attach or hang the catheter bag from a side of the bed that is unmoved. And just keep the rest of the tubing up on the bed. Oh, okay. Yeah. And I would have had a piece of tape here too. Must have forgot to grab that. So, okay. Also, now I would do pericares on Mrs. Smith to remove all the betadine and to make sure she was comfortable. Cover her up, adjust her bed, adjust the head of her bed, give her the call light, and then I would do my charting. I'd also be observing the catheter bag, make sure it's draining properly, and just keep checking on the patient every hour or so. Okay? Thank you.